Okay, so we have today Gavin Haig here. Was until recently a part-time surgeon at Torbay and a relief doctor. He's very gallantly saying that he doesn't recognise any of you. He does. He's also past chairman of the Mid-Devon Natural History Society, and also past chairman of the Devon branch of the British Butterfly Conservation. A wide-ranging set of interests here. Featured in Daniel Way with Brian Johnston about wildlife garden in Lower Washfield, and also BBC television programme with Charlie Dimmer demonstrating pond wildlife garden and river X at Spurleyford. Charlie Dimmer describes Spurleyford as probably the best wildlife garden in Britain. And also does regular monthly articles in Devon Life entitled The Healing Garden. So I hand you over to Gavin.
Thank you very much. My passion for wildlife is that I was to give talks, illustrated talks about creating a wildlife garden and the healing garden, which is obviously very appropriate. I've developed one at Tribulations Hospital, and the patients and the staff come out and talk to the butterflies and the hedgehogs as well. So that's good. However, trials and tribulations of being a surgeon. Why, I wonder. I want to take you back about 75 years. I was struggling with, I was just coming up to the 11 plus, and I thought, I had to struggle through it. And I thought, right, what is my career to be? And I obviously had a passion for wildlife. I love birds, butterflies, and wildflowers. And I thought, well, that would be my career. And I'll breed butterflies and sell wildflowers. Then I thought, well, actually, I don't know that I can raise a family on that love. So perhaps I love people and I love the idea of caring for people. So maybe medicine or the church.
Barry, stop,
and,
Barry.
I was at a school very like Blundell's. I don't know if you know Blundell's, but it was cheap. They only studied classics, so I was going to do Greek, Latin, and ancient history.
Barry, don't.
I thought, how about medicine? And I just thought I'd write down what I thought was my views of medicine. It's everything. It's such an empire. People, buildings, meetings, politics, engineering, teaching, research and development, simply a route to everywhere. It's international. So I thought, I think I'll give it a go. So I managed to get an interview to Bart's Hospital, that's St Bartholomew's, the oldest London teaching hospital. And I thought, right, I'll go along to this interview, and I'm sure it won't go very far because I've studied classics and they all want to know why not science. So I saw the dean, and the dean, rather like the mafia, said, are you prepared to work all night? The question expected the answer yes, because if you said no, that would be the end of it. So I said, yes, I certainly am. And he said, I see you've done classics. And I said, yes. So I thought that was the end of the interview. But actually, he said, well, amazingly, we have a classics scholarship into Barts. Would you be prepared to take it? So I said, yes, I'll give it a go. And it was a brilliant exam. And it really was a very challenging exam. But I was running out of time a bit. And one of the questions was, is this a good question? So I thought, right, yes, comma, if this is a good answer. so that was going to be the end of it. And the dean, as I walked out with the others, he said, I'll let you know how you got on in a couple of weeks' time. And in 2 weeks' time, sure enough, the phone went, and he said, amazingly, I've got good news for you. You've won the Jefferson exhibition, welcome to Barts. So there is a back door into medicine after all. And so that was lovely. But when was that? 1956. So it's a long time ago. Now, I don't think that casts your mind, many of you can, I think, to 1956, and Budapest, Hungary, Russian tanks coming in to the capital and forcing people away. Fast forward, Ukraine, but we won't go into that just at the moment. But it was extraordinary because they were asking the wonderful students, look, just leave, get away, go west, go to the States, go to Western Europe, but just get out because you can't have the war and tanks coming in at you here. So 3 of those lovely Hungarian students came to Barts along with me. And it meant doing first MBE in a year at Barts, because Barts actually taught first MBE at JohnH Square. So, physics, chemistry, biology, not 2 years, in 1 year. And so it's going to be quite a challenge. There are about 40 of them, 40 of us, and 3 were Hungarians. They all spoke very good English. And they were really bright. And the dean's son and dean's daughter were in our year. There were about 40 of us. And it was very well taught, but it was a mighty tough. And an awful lot of our intake were women and ladies, and they were wonderful. And they worked much better than we did. And they got up at 7 in the morning, made us cups of tea, the whole lot of us, and told us blokes to get on with it and work hard. And we worked mighty hard for that first MD, all in a year, and it really was tough. Anyway, at the end of the year, we had to take the exam. And then we were told 10 or 11 of you will get through, the rest of you will have to leave, and you have to start and think again. And so, amazingly, I think I managed to get through. But 1, 2, 3 Hungarians all failed. They were lovely, all failed and were asked to leave. The dean's son failed and he was asked to leave. So they were tough years. So that's first MD, then another 18 months preclinical, second MD. And what was second MD? Well, it was anatomy, lovely anatomy, biochemistry, physiology, pharmacology, and nuclear physics. And it's all about isotopes and X-rays and things. And there was no way a dear old classic student like me would do anything there. That's the end of it, really. And we were going to be taught nuclear physics by a Polish gentleman, world famous, a nuclear physicist. He knew how to construct atomic warfare, but he came to Barts because he was very keen to use his knowledge for peaceful purposes. So he developed an electron speed machine to help cancer patients. So he was quite simply a genius, wonderful, magnificent, and very, very clever. So you wouldn't be any good at teaching, because geniuses or genii never are particularly good at teaching. So what was it going to be? A group of us sat at the back of the lecture theatre, rather like you're up there, nicely away from this nuclear physicist who was going to teach us nuclear physics. There was no chance that we would get anything going. So in came this dapper little man, and he said to us students, he came out to us and he said, "Today I'm going to take you to a wonderful, wonderful place. You will never know. It's called outer space. I will show you electrons, neutrons, protons, and you will be weightless. You will never want to come back. Are you coming with me?" And all the students said, "Yes, of course we're coming." He was brilliant. Here was an international nuclear physicist working at Barts, and he was teaching us nuclear physics. We all got through nuclear physics in second MB, and it was an amazing experience. He was an absolute delight So what a privilege. And even I had the sense to say, what a privilege to be taught by this absolutely wonderful man. What was amazing for me was anatomy. The human body is beautiful. It's sometimes difficult to understand this, but it's absolutely magnificent. How do I know? Well, there was a room not much smaller than this lovely hall here, and it had dead bodies, corpses, and we had to go in and dissect them up to learn anatomy inside out. And the human body is a miracle, absolutely beautiful. When you dissect it out, it is absolutely incredible. So, believe it or not, we went into it rather apprehensively into this anatomy department with these dead bodies for us to dissect out. But we did, and amazingly, we got through. Quite a lot of students didn't get through second MB, the other preclinical time, and were asked to leave. So it was tough in those days, 1956, 57. So a long time ago, and it was mighty tough. But then, clinical. So about 400 yards away is the oldest London teaching hospital, St. Bartholomew's Hospital, next to the oldest London church, St. Bart's the Great, a beautiful church. And you go through a Henry VIII gate into this wonderful quadrangle, and here is going to be our clinical years. And the clinical years are teaching about 3 or 4 monthly, medicine, general surgery, pediatrics, gynecology, X-ray and radiotherapy, orthopedics, maternity, all those sections of medicine. And we had to learn them. We were taught each section, and at the end of that 3 years, clinical years, having been taught all the medicine that we could know and surgery, then we take the finals. So during those 3 years, I found medicine fascinating, and pediatrics was rather sad, I have to say, but there was a wonderful opportunity for surgery. And what you could do is, in a gallery, you could look down into the operating theatre and see the surgeon operating. And I loved that. And it was inspiring. There was a guy called Alan Hunt, and he was the only surgeon doing portacable anastomosis in England. They were doing it in the States. It was where sort of contracted or cirrhotic liver, and it's a bypass operation, 8 hours. And we were looking down into this operating theatre, and here was Alan Hunt with the team around him, and these patients being operated on for hours and hours. But the results were wonderful. And I don't know, I'm sure the ladies will remember, but Margot Fontaine was just absolutely glorious ballerina. And just to see her skills and beauty at her dancing, I was being inspired by the courage and the teamwork shown by Alan Hunt and his team in the surgical operating theatre. So I was so inspired, I thought, I'd love to train to be a surgeon. And so I went to see my tutor. There was a surgical tutor on each firm. And I said to the surgical tutor, you know, I've been so impressed. And it's wonderful to see how patients are restored. They get better. I said, get better, sir, I said. I so like to train to be a surgeon. And his response was really, and then there was a huge big pause, and he said, you've got no chance. And then he said, what's your father doing? Well, he's a lobby correspondent in the House of Commons. And he said, well, he's not medical. Oh, you have got a chance. You really certainly have got a chance. Look, 1 in 100, 1 in 50. What chance have you got? And I thought, that's not very encouraging. I'm going to just jolly well bash on. And so I jolly well did. I managed to get through the finals. I tell you what it was, May 1964, I qualified as a doctor at last. Now, if you work it out, it's 60 years this year, and we're going to celebrate those us who are deaf, because we're all in our 80s, and a doctor to celebrate that we became a doctor. But obviously, when I was a doctor, I said to the surgical tutor, look, I'm qualified now, I still want to be a surgeon. And he said, you know, you're a menace. You've got no chance, don't understand what I'm saying. And then after a bit, he said, right, I'll get you to work for Mr. Jackson Burrows. And that's a 6-month job, it's orthopedics, and with a bit of luck, that's your own Barts hospital. So here we go. And so, what did we do? We did an operation called a McMurray osteotomy, as well as others. Why did we do McMurray osteotomy? A lot of lovely ladies, nearly all of them are ladies, usually about 75 or that sort of age. And they had a problem in their hip. I have to put this down. So I'll speak as loud as I can. This is a human femur, and that's the head of the femur and the trochanter, and that's the shaft. That is, for all these ladies and some men, it got really, really very, very painful and stiff osteoarthritis. So they were either with sticks or crutches, or some of them would be even in wheelchairs. And they came to the outpatient saying, please, will you help the pain in my hip? I can hardly walk, and it's due to this naughty joint. Sure enough, the joint was nearly always osteoarthritic and fixed. So really and truly, it was painful and very difficult to move. So what we did is we anesthetized the patient, manipulated the joint, and we did this. A McMurray osteotomy. There is the femoral head and neck, and there is the shaft. So that is how it was. We actually went in and divided the bone. We moved it and we massaged and mobilized the osteoarthritic hip. And then we rotated it and repositioned it and fixed it in the new position with pin and plate. And that was how it was. So that was a McMurray osteotomy. Osteo means bone, tomy to come. So we divided the bone, we caused a fracture, effectively. The wonderful thing is that most of these lovely women went back to the ward for about 10 days and had physiotherapy for the chest and obviously for the new hip. And after about 10 days, it was absolutely wonderful. They got up and they walked again, and they smiled, and they said, the pain is minimal, and I can walk again. And then they said 2 lovely words, thank you. Thank you, Dr. Haig, in those days. And I just thought, this is wonderful. And so I went back to my surgical tutor and said, it's been the most amazingly good 6 months. I've really enjoyed it. Thank you so much. And he said, right, it's you again. I'm just a bit fed up with you, but I'll tell you what, I know what will finish you off. I'll send you to Southend General to work for Mr. Donald Bono. Do you remember at the interview, the dean said, are you prepared to work all day and all night? And Donald Bono was a perfect example. Donald Bono worked at Southend General, right out on the coast, lived at Harpenden, which is near St Albans, and he got up at about 6 in the morning, worked till about 7, and then had breakfast, drove all the way to Southend General, and then did an outpatient clinic, brief lunch, an operating list, and went from there to the London chest clinic and many other hospitals, and then went home to Harpenden, got home about 10:30 or 11 at night, worked till about midnight, and that was Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and some Sundays. So when the dean said, "Are you prepared to work all day and all night?" he knew what he was basing that on. Donald Barlow was wonderful because he was encouraging, and so much so that he said to me, "What I'll do is I'll organise some hernias and some vascular works and practice veins and others. You do that down in Theatre A, come up and see me in Theatre B this afternoon, and we'll discuss what we've done." And lo and behold, it was wonderful. I said I'd just done some hernia repairs, and he said, "Yes, that's fine." And the diathermy was fine with the vascular case. "Yes, fine." And I said, "What have you done?" And he said, "I've just done a cholecystectomy." And he said, "Do you know what that is?" And I said, "Something to do with the gallbladder." He said, "Yes." And he produced an amazing diagram. This is far from amazing, but it just might give you an idea. He said, "Look here, this is the gallbladder. If you look there, the tumour was there. I've excised the tumour, put it into the jejunum. So we've got a bypass operation. This lovely lady will be fine for another 5 to 10 years. There is a diagram of what I've done." And so there was an amazing, and he'd done all these superb diagrams. So I learned, and I'll hand that around so you can actually, some of you can have a look and see. But it was just a superb example of sketching the operation, because that would mean it's a permanent record, and it was superb. So that was wonderful. And then we had an international meeting. And the international meeting was for an endoscopy. And I thought, that's strange. There were people from the States, from Australia, from mainland Europe, and much else. And they were coming to dear old Southend General Hospital to see Donald Barlow talk about endoscopy. Now, if you have an endoscopy these days, it's lovely. It's all bendy, you can move it in all directions, you can slip it down, and it's jolly nice. In those days, it was rich. It was a brass tube. And so, what happened was these people were coming from all over the world, and one of them from the States said, "You working for Donald Barlow? Do you realize I'm an amazing man?" I said, "Yes, I realize he's fantastic." He said, "But you don't understand. Have you seen him with his endoscopy?" And I said, "No." And he said, "Right." And it was like this. Donald Barlow said, "Right, I'm going to show you what I do. And here is the rigid scope, and it's just like this." He went, "Shoom." And then he went round patients, and he said, "Look, if you have a look, you can see there. You can see the jejunum, you can see the duodenum, there's the stomach, there's the esophagus," and it was just like that. And then there was this lovely lady called Sheila, and he said, "Nice to see you, Sheila. Very good to see you from Australia." And Sheila said, I'm very nice, very good to see you all. I must confess, but I've got to tell you something. There's no way you're going to come near me, because I don't like endoscopy, and you can steer clear. Here is Sheila." And he came up to Sheila, and it was just like this. He said, "Now, Sheila, you don't want this to go," and it was down. And then he got hold of Sheila, if I can, and he said, look, if you have a look at Sheila, you can see her stomach there, and there's a, and then he said, "No, I can speak in English." And then he was going round to all these people, showing dear Sheila's inside. And so they were very impressed. And Sheila said, "Do you know, I don't believe it, but I think that's the best endoscopy I've ever had." And you think British is best? I actually have to say, I think it is. Anyway, he was just wonderful. And he was a great success. So here was encouragement to poor old me, who was in no way to be encouraged to be a surgeon. But oh yes, it was absolutely amazing. Then I went to back to Bath to teach anatomy, and if you're going to be a surgeon, you have to, and you'll understand circulation's inside and outside, absolutely perfect. This is a human larynx, that's a voice box, as there. And so when it comes to teaching and knowing the detail, you have to be very skillful. So I used to say, right, tell me, that's the thyroid cartilage, yes, fine, the epiglottis, what's the blood supply? What happens if you hit the nerve, the recurrent laryngeal? Yes, the patient becomes, yes, hoarse, correct, yes, fine. And you had to know it in absolute detail. What's the blood supply? What's the venous drainage? And so you really had to know. So I do promise you, the surgeons you might meet have really, really had to learn their anatomy inside out. And it was, so I managed to struggle through the FRCS, and then it was a question of casualty. And I had the privilege of going to the Birmingham Accident Hospital, not there now, sadly, but it was everything. It was crush injuries, it was stab wounds, burns, road traffic accidents. And the ambulances used to say, "Doctor, you come with us. You're coming to the site of the accident, and you'll see just what we have to deal with." And I have great respect for paramedics who now have to go to these accidents, whatever they may be. And in those days, there would be a wrecked car here, and literally bodies elsewhere, about 10 meters away. So that is when Gavin decided we must get on to seatbelts. So that was at the Birmingham accident. I even had to do traumatic brain surgery, can you believe it, me? And I worked for a wonderful guy called Henry Hicks, who was not only a consultant surgeon, but he was also a qualified engineer. And he had developed lug plates for forearm fractures so that you could get the fractures really held together beautifully. So he was an amazing guy and very wonderful to work with. On the first day of the Birmingham accident, there was a guy with a severed arm, and on the final day, there was an 18-year-old boy found outside a park dead. We looked all over, we examined his naked body, couldn't find anything. And there, over the heart, was a minute little opening. In those days, it was stilettos, and somebody had gone up to him and hit him with a stiletto right into his heart, and that was a fatal. So that was the Birmingham Accident Hospital. What an experience. Then I was a general surgical registrar, so I was beginning to progress with my surgery. And I learned all about prostate surgery and later abdominal surgery. But what was a heck of a challenge? And so, if ever you need a challenge in your life, take this. There was a lovely, lovely nurse, aged about 25. She was at Princess Alexandra Hospital in Harlow. She'd been involved in a car accident and had damaged her kidney, she had blood in her urine, so they needed a surgical approach. So I got this urgent message. It was about midnight. At 1 o'clock, when I sorted everything out, I rang the chief, the consultant surgeon, to say we've got a nurse here who's got a damaged kidney and will need a kidney operation. I haven't done one before, but there was no reply to the phone. I rang again at about 1:30 and there was still no reply. So I read up the surgical techniques that were used in those days for approaching a kidney. Here on a 25-year-old nurse, I had to operate at 3:30 and need a special position, you may know, to get to the kidney. And I operated, went down in layers under general anesthetic, had to call the whole surgical team and anaesthetist together, went down, found the damage. I managed to put it together rather like a jigsaw puzzle and repaired in layers, came out, put a drain in, and thank the Lord, she did really make a very good recovery. But can you imagine the strain of pressure that I felt operating on a 25-year-old nurse. However, it certainly survived. I then went on to work for an orthopedic surgeon, a registrar, and the orthopedic surgeon was Geoffrey Fisk. He had an international name because he was a hand surgeon who developed a little screw fixation for scaphoid fractures in the carpal bones of the wrist. And he was therefore amazingly successful with that type of operation. But in those days, if your hip was falling apart, if you've got an really seriously arthritic hip, and it needed an operation, or you fractured your hip and you needed the head of the femur cleared away. In those days, we used an Austin Moore prosthesis, and that's what it looked like. I can hand that around too, but it's heavy, and so what you did, literally dislocated the hip, went in, cleared all the damage, pushed in, and literally closed over that artificial hip. But in those days too, John Charley from Wrightington in England had developed a smaller hip replacement which was cemented in place, not just loosely put in. And it was a huge success, particularly in the older patient with the arthritic or painful stiff hip. It's, as you know, a common problem. So it was a wonderful success, and we were doing it at the old and St Margaret's Hospital, Epping and Harlow, and it was just a wonderful opportunity to work. So I'll hand this round. You can just see how heavy that is. That's really heavy there. And that we developed this improvement, and it was going very well in older patients. And then one day, there was a wonderful lady, a 44-year-old lady, who came into the outpatient department in a wheelchair, and she said, "Mr. Fisk, I want to tell you a story." And she was absolutely lovely. She said, "I'm 44. I want to take you back 40 years. I was 4, and I had a problem with..." Is it still there? I had a problem with my right hip when I was aged just 4. And it got more painful and stiff, and I found it very uncomfortable. Then, when I was 7, I developed a pain and stiffness in my left hip as well. So my right and left hips were both painful, stiff, and very difficult to walk on. I therefore had to use crutches, and then at the age of 15, I then had to resort to a wheelchair. Mr. Fisk, I've been in a wheelchair ever since. What can you do? He said, "Well, look, you're 44, and that we don't operate on young people." She said, "Ask the ethical committee and see if they will say yes." And so we did ask the ethical committee, knowing they'd say no, but they said, "Yes, give it a go." And so, provided we can keep a close check on her post-operatively. And so we operated. Mr. Fisk did one side, I did the other, and we did these charmingly cemented in place total hip replacement. And so the operations went terribly well. The patient went back to the ward, and the brains came in out next day, and the sister said everything's fine. And so the next day we thought we'd go and have a look and see how she was. And unfortunately, there she was in a corner in floods of tears. And Mr. Fisk and I thought, "Oh, goodness, what's gone wrong?" And we said to Sister, "I thought it was okay." And the sister said, "Yes, I thought it was okay too." Anyway, at that moment, she got up and walked with her hands out and floods of tears. She said, "I shall never be able to thank you enough for what you've done." So it was, in fact, so could I be anything else but be a surgeon? It was just an amazing experience. And so I thought, that's it, I've got to go and do that as my career. So So I got the fellowship, so on I went. Now, after the registrarship, the pre-consultant job is a senior registrar, and if you can get it at your own hospital, that's fine. I was shortlisted at parts, but Jerry Gilmore got the job, and Jerry's a good guy, so that was fine. So I was going to go to Canada, where you could be a surgeon and a doctor, all in one. I was going to go to British Columbia, and then there was an advertisement saying senior registrar required at the Royal Free Hospital, London. And so I thought, okay, I'll put in for it. I won't get it because it's a London teaching hospital. So I put in for it, and it was for Mr. George Quist at the Royal Free, which is mainly run by wonderful women, a lady women's hospital, mainly. Wonderful international names there. So George Quist was going to be there. But when I went to the interview, it was Phyllis George who was doing the interview. George Quist was elsewhere. And so she did the interview, and sometimes, when anything happens in your life, sometimes the interview goes really well. And everything I was asked, I thought, I know the answer to that. Anyway, at the end of the interview, Phyllis George called me in and said, Gavin, Haig, would you like to come in? And she said, we've got the job for you to work with George Quist. The only thing is, nobody had told me that George Quist was Sir Lancelot Spratt. Now, those of you who know Doctor in the House, this crazy surgeon was based on Sir Lancelot Spratt. It was actually played by James Robertson Justice in the film with Oban, and it was lifted about 50 years ago. But it was a wonderful and very popular film, still shown quite a bit. So I was going to work for this guy. Actually, his name was George Quist. Now, George Quist was big, huge, and shouting. He didn't do anything. Everything was a shout. He didn't do anything quietly. And so he was very, very noisy. And so Phyllis George, you remember she did the interview, she said, he's going to be here next day, so stay over, and I'll introduce you to George Quist. So, for some reason, which I now know, Phyllis George took my hand and held it very firmly, because downstairs came George Quist, this huge man who shouted. And for instance, this is how it went. Who on earth are you? I don't want you. So that really was rather a nice introduction. The senior surgical registrar has been appointed. And then I went on a ward round and realised this man was a political dynamite. At the ward round, it would be something like this. Yes, yep, fine, yep, fine, yep, what's his name? Yep, okay, yep, yeah, Richard who? Daniels, yes, yeah, Richard Daniels. Friday, yeah, fine. Yes, sister, am I? Yeah, I am. I'm doing the interview, yes. He's a good boy, is he? Yeah, fine, you'll get the job, then you'll get the job. And that is called politics, who you know. So that was that. But also, I don't know if you're like me, when you're going to have a blood test or a vaccination, you go, the little thing in there saying you will not squeal. You will just be smiling all the time while you have the blood test done, even if it hurts like heck. Anyway, George Quist, you didn't need to worry about that. And Jan is going to come out for a moment. Here she is. Jan is going to receive an injection from George Quist. Now, you have to remember, thank you very much. So, George Quist, so you know when you get a little injection, you go, oh, God, yeah. You try to make no fuss about it. You didn't have to worry with George Quist because he did all the sound effects. So, Jan is going to have a vaccination from George Quist. It would be something like this. Jan, I'm going to operate. I know, I'm going to vaccinate. I'm going to vaccinate you now. And this is not going to hurt. Ah! That's how I can do it. So you didn't have to worry if you were going to make a squeal. Now, I don't know if there's a lovely Philip who's going to come up. Philip, if you'd like to come forward. So, Philip is me operating. He's going to mind it. He's very, very well trained and very well versed. And he's operating here at this end here. And here's George Quist. Now, this is a major operating theatre at Gray's Inn Road. And this is George Quist coming into the operating theatre. Now, I don't know if you know about masks, but you actually wear them so that the mask itself does hold around the mouth, or mouth and nose. But he actually had it down here. Why did he have it down here? Because this is called a cigar. I don't even know that. You don't believe this, but it's true. In the operating theatre, you came in smoking a cigar. Now you've got half a dozen students learning how to behave in a major operating theatre in London. And here is George Quist coming in wearing a cigar, and he's saying, "How you getting on, boy?" And he leans on my shoulder. And he says, "You getting on all right, boy? Oh, look, your assistant, he doesn't know what he's doing. Cut it thing. Cut it, boy. No, you're doing very well, Gavin. Yeah, now you don't know what you're doing. Sister, cut his head off." That's how he was taught. So I had to experience all that. And thank you very much for doing very well. That's true. Now, the next thing is that it's actually the lady from Luton. Now, I don't know if you know, my wife would say, do not tell them about the lady from Luton. However, my wife is here today, so I'm going to tell you about the lady from Luton. Now, I don't know if you know, she has an autism problem called piles. I don't know if you know about piles. Here's the lady from Luton, and she's in the left lateral position, so she's facing out to you, the audience. Don't forget, we've got George Quist here, and this is an outpatient department, every bit as big as this lovely hall. There's medical outpatients there, orthopedic outpatients, maternity there, and surgery here. So this is an open department. And if you remember, George Quist shouts. So you could hear George Quist from here at the Imperial Hotel. So everything was very noisy. And here's our patients. We've got 6 students learning all about piles. Right? You tell me what piles. Yes, swellings between the buttocks. Absolutely right. Yes, quite right, boy. Now, what are you going to do? You're going to inject them. Yes, good boy. So how are you going to inject them? Yes, fine. Yes. And Sister's going to show, yes, she'll give you the right, you'll be able to see. You'll watch me inject. Yes, good man. Right. So, of course, being quite good with instruments, the lady from Luton, he then greets her and says, "Madam, all the way from Luton, right? I shall call you Lucy from Luton. Are you ready? Right. You've got piles. Well, I won't tell anyone, but it's only the National Health, don't worry about it. You sit down. Hey, come on. Now, of course, you're going to inject the tail end. Ah! He goes like that, slams it into the tail end. He's now got to inject, and of course, it needs an injection, it needs sclerosing solution to seal down the naughty veins. And that will make things better. It just needs a light. Sister, the light! The light didn't work. So here's the lady from Luton lying in the left lateral position. She's got the scope in her tail end, and all George Quist does, don't forget he doesn't do anything quietly. Sister, the light, sister! I want the light, where's the light, sister? Give me the light. So this lady from Luton must have thought, this is an incredible way to treat the piles. Instruments flying all over the... Yes, sister! Thank you, I need a light, sister. In the end, sister came rushing back and said, Mr. Quist, I can't find the light. So, he said, right, hang on! Can you come back next week? next week, I'm going to report you to the GMC. But no, it's actually quite true that this lady came back next week, and she said to him, "Thank you for doing the piles, Mr. Quist. You are the best surgeon in town." So can you understand? Frankly, you haven't got a chance with someone like that because it's just impossible to survive. In those days, I thought, right, I've had enough of this, and I got this wonderful advertisement which said, "Surgeon with FRCS required to work in Exmouth, and Pavilion, JohnH and Exmouth Hospital." There was also an option of having your own general practice, which is what I've always wanted. And when I first came into Pavilion and the Royal Pavilion in Exeter, what operations was I doing? Well, it was incredible. Major breast surgery, vascular. I was doing feet, knees, hands, wrist, shoulder, vascular and facial and chest. And hernias and major abdominal surgery, and obviously various things, and also on children, tonsillectomies and appendectomies. So quite a broad spectrum, to say the very least. I was doing that until I was 75, 2013. So it was a wonderful experience, and I had a glorious practice. And it was a great privilege being a doctor and helping patients on their journey. Most will get better, and it's just lovely to say together we'll get you through. So it was a fantastic occasion. Just to final bit, just to tell you that your National Health Service, I think much of the health service is excellent. And I've said it's ever improving. Anesthetics. Superb general anaesthetic skills, regional anaesthetic blocks, for instance, you can block off areas under anaesthetic, and sophisticated local anaesthetic. A lot is being done under local anaesthetic. And we can now do hip and knee replacements, as you probably know, as an epidural, in other words, an injection into the spine, freezes it down. There. The technology, there are fiber optics, wonderful lights. George Quist would have loved them. And these days, no longer this awful, solid glass tube. Now flexible scopes that can bend in all ways. They can biopsy, they can wash, and they can do just about everything with them. They are amazing. And obviously a biopsy to secure the diagnosis. Imaging scans, they are just superb, more and more sophisticated. Ultrasound and the echocardiography, where under ultrasound you can see the valves of the heart working and see how they are. And MRI scanning, magnetic resonance imaging, and that's really for skeletal bones and joints to see the state of those mainly. And then, of course, the CT scanning, computerized tomography, multiple X-rays spinning through, so you can use it for soft tissue, total body scanning, brain scanning. It's just absolutely incredible when you see what's done. Joint replacements, oh yes, there's hip, shoulder, knee, ankle, wrist, hands. And in my day, in the sort of general practice side, if you had an autoimmune heart that was giving you trouble, ischemic heart disease, the blood supply wasn't good enough, you might alter the medication, there might be a bit of physiotherapy or hydrotherapy, and it would all be very gentle and benign. Now, coronary artery bypass grafting, using vascular, usually veins from the leg, to repair the vessels and the diseased vessels. Or stenting, where they put a microtube in and expand it to make the vessel work again. Absolutely incredible stuff. There's ever improving oncology for carcinoma. Now, of course, the treatment for carcinoma will be genetic. That's the way forward for that. So, just to end the message, would I go through all that again? And the answer, surprisingly, is yes.
What a remarkable man.
Oh. I'm probably not the only one. Putting anaesthetic. Just struck me that you're driving around in your car with a box of components. Do you have a clear story of how you get stopped?
Actually, it once happened on the underground that somebody saw the bones in my back and said, I hope they're not human. I said, oh yes, they're human. And I'm not going to take them home to talk to. I shall be very discreet. But yes, teaching anatomy I love, and it's a great joy. But medicine is a wonderful, wonderful journey. And the great thing is the vast majority of patients get better. And so if you, for instance, have a problem in the shoulder, you might say, right, okay, can you keep you awake at night? Right, okay, I'm going to get you to do these special exercises with massage, but I'll get an ultrasound scan, I'll get you some physiotherapy. 2 weeks later, they'll come back and say, look what I can do. And together, it's just a wonderful journey, a huge privilege being a doctor. And it's wonderful, wonderful, because you're part of the family, really, and you're taking the journey together. So, Mike, thank you very much. It was a great.
Well, have you got any questions? I don't mean, Doctor, what can you do about it?
You mentioned medical ethics once.
Yes.
What's the biggest change you've seen in ethics during your career?
I have to say that's a mighty good question. I think there is an opening where they are prepared to listen to a balanced equation. So if you say, look, the way forward with this patient, the only way forward is to manage on this type of treatment. We've got surgical techniques, we've got some medical programs to deal with this. And they usually are very, very supportive now. But it is a tough area. And most of us are living to an older age. And so it is a very important part of medicine, the ethical area of being able to discuss and reason. But this is what we need to do more and more, is to discuss, open it up with the patient, these are the options, and the ethical committee are usually very, very supportive. So that has been a great improvement, or a great encouragement. Thank you.
Thank you for such a fascinating talk. I've never enjoyed one so much in all my life. I noticed that you're interested in wildlife.
Yes.
Have you found any interesting examples in some patients' undergrowth? Have you found any interesting examples of natural life in patients' undergrowth?
Yes, I have, thank you. It's very interesting. As a doctor, you become very balanced. You know, if somebody says, well, I'm awfully sorry, I mustn't take my clothes off. Well, doctors don't mind. They're just so utterly used to as it were, the general option. I think the human body is a miracle. It's beautiful. So whether it's outside, inside, covered up or whatever, the body is an amazing, beautiful human body. And it's difficult perhaps for you to do, but when you dissect the human body, it is miraculous how it all works. And when you think about it, how everything sort of ticks out and the mind works it out and the physical side, it is just an extraordinary pattern of survival. So the body is beautiful. I promise you. Yeah.
Locally, we've heard of the Exeter Hip, which was supposed to be an amazing, forward thinking.
Yes.
Is that still one of the best?
The
Exeter Hip.
Oh, the Exeter Hip. Yes. Yes, because the fellow who did my left hip, Graham Gee, has gone worldwide selling the Exmouth system. Says 40%, this is what he said, so I've got to believe it, 40% of hips worldwide are the Exmouth system. It is an excellent system. Obviously, I'm having worked there. I'll go on to Spotlight and say, by the way, the Royal Devon in Exeter is the centre of excellence. But it really is, the orthopaedic team are a wonderful team. And the Exeter system is right up there. It's an excellent replacement. Mine is 34 years old. Still there. So there's something good about it. Yeah, it's very good question.
I've had 3 hip replacements.
Sorry.
I have joint and osteoarthritis. And I've had 3 done at Exeter.
You had them done?
Yes, and I've had 3.
And you're fine?
Yes.
There you are. That's good news. I'm very pleased to hear.
What's the Exeter hip?
You may think that the world is in pieces, and in some ways, very sadly it is. But your dear old health service, I know you hear a lot that's not so encouraging about it, but it is actually a fantastic system. And at the core, it is really wonderful. And I love working for it. I did 50 years, as you gather. I worked 50 years for the health service. So there's something good about it. And the teamwork is wonderful. So don't ever let go.
All right, thank you very much, Gavin.